Hey, future ICU heroes out there. We are going to take a deep dive today into something I think super relevant to all of you listening. How to absolutely ace your NHS ICU nurse interview.
That's a big one.
So you've done the work.
Right.
You've got the heart.
You got the skills.
And now we're going to give you
absolutely
that extra edge to really shine in that interview.
Tell me.
So we are going to be dissecting a YouTube video today by How to Become.
How to Become.
Which is
a
professional interview training company.
Yeah, they're great.
And they have got some really smart strategies to share.
I think it's interesting how much they emphasize not just your clinical expertise, which obviously you've got, but those soft skills that make a real difference in a high-pressure environment like the ICU.
Right.
So we're talking communication, empathy, the ability to stay cool under pressure.
Right, that kind of thing.
Which makes total sense because when lives are on the line, it's not just about what you know.
Right.
It's about
how you apply it.
How you connect with the patient.
Yeah.
Their families, and the entire team.
Your whole team.
So let's jump right in with a question that seems simple, but actually has hidden depths. Tell me about yourself.
It might feel like an icebreaker.
Yeah.
But it's really your chance
to
grab their attention and showcase how perfect you are for the role.
Yeah.
And the key is to tailor your answer to the specific job description.
Right.
So spend some time with that beforehand. Highlight keywords. And then weave them into your response.
So it's not just reciting your CV.
No.
It's showing them that you've already envisioned yourself in that role. Almost like you're speaking their language.
Exactly.
From the get-go.
They give a brilliant example in the video.
And it's not just, I'm a registered nurse. It's more like, I'm a highly motivated nurse with a proven track record in fast-paced environments. And I'm passionate about delivering exceptional patient care within the NHS.
So it's like creating a movie trailer.
Yeah.
For your career, highlighting the blockbuster skills they're looking for.
Exactly.
I like that.
Yeah.
And for those without direct ICU experience, how do you make those transferable skills shine?
That's where you connect the dots for them. So let's say you've worked in a busy A&E. You can highlight how that experience honed your skills in rapid prioritization and teamwork. Both absolutely essential in the ICU.
And don't forget those certifications. So you've got your NMC registration, which is the Nursing and Midwifery Council registration. Required to practice nursing in the UK.
Correct.
And any additional qualifications like advanced life support training. These are like badges of honor. Showing you're ready for the challenge.
It's all about demonstrating that solid foundation. And that hunger to learn and grow. Now get ready for this next one. Why do you want to be an ICU nurse? This is where your genuine passion for critical care takes center stage.
It's more than just saying, I like helping people, right?
Way more.
Okay.
Think about what draws you
Yeah.
to the intensity and complexity of the ICU.
Right.
Is it the challenge of caring for critically ill patients?
Yeah.
The quick decision-making?
Yeah.
The feeling of being part of a highly specialized team? Let that enthusiasm shine through.
Yeah. I've got a friend who works in the ICU.
Right.
She always talks about the immense pressure, but also that incredible feeling of really making a difference when lives are hanging in the balance.
Absolutely.
You have to convey that sense of purpose. Absolutely.
And this next question
Okay.
might feel a bit trickier. Especially if you're newer to the field. Yeah. What experience do you have, which is relevant to this NHS ICU nurse position?
Right. For someone without direct ICU experience, this one might feel a little intimidating. Where do you even begin?
So the video emphasizes showcasing those transferable skills we talked about.
Right.
Maybe you haven't worked in an ICU specifically. But have you dealt with acutely ill patients in a high-pressure setting like an A&E or a busy surgical ward? Don't underestimate those experiences.
So it's about painting a picture for them.
Yes.
Showing how those experiences, even outside the ICU, have equipped you with the skills and mindset needed to thrive in this environment.
Exactly.
And this is another opportunity to showcase those certifications.
Oh, yeah.
That NMC registration.
Yes.
and any specialized training demonstrate your commitment to professional development, which is highly valued.
Very much so.
In the NHS.
Yeah.
Okay, let's move on to a question that gets to the heart of patient care.
Okay.
How do you communicate with critically ill patients and their family members?
This is where empathy becomes your superpower.
Yeah.
Think about it. You're dealing with medical complexities, heightened emotions, lots of fear and uncertainty.
Yeah.
The video really hits home on the importance of simplifying medical information, using clear language and truly listening to their concerns.
So it's about being that steady, reassuring presence in a storm.
Absolutely.
Imagine being that family member.
Right.
Desperate for information.
Yeah.
Terrified for your loved one.
Yeah.
Those clear explanations and compassionate words
makes all the difference.
Would make all the difference.
Yeah.
It's about recognizing that you're not just treating a condition.
Yeah.
You're caring for a human being.
Yeah.
At their most vulnerable moment.
Absolutely.
That's so powerful.
Yeah. Powerful stuff.
Now, let's move on.
Okay.
Some of the other questions they recommend prepping for.
All right.
They've got a really interesting mix. Questions about teamwork, personal goals, how you handle difficult patients, and even why you'd leave your current position.
Okay.
Pretty standard stuff. But then they throw in one that really piqued my curiosity.
Oh, really?
Can you think of a time when you would break protocol or procedure in a clinical setting?
Interesting.
Now, why on earth would they ask that?
That's a great question, and this is where it gets really interesting. So it's not about whether you would actually break the rules. It's about assessing your judgment, your ethical compass, and your ability to think critically in high-stakes situations. They want to see if you can weigh potential risks and benefits while upholding patient safety and ethical standards.
So it's less about saying, sure, I'd break the rules.
No.
And more about demonstrating that you can think on your feet.
Exactly.
Make tough decisions and still maintain that highest level of care.
Precisely.
Yeah.
They're looking for a critical thinker.
Right.
A problem solver who can navigate those gray areas with integrity and always prioritize patient well-being.
That's such a great insight.
Thanks.
It completely changes how I'd approach that question.
Yeah.
So we've talked about tailoring answers, highlighting transferable skills, showcasing that passion for critical care.
Right.
And even tackling those curveball questions.
Yeah.
What are some other key takeaways from this video?
Well, I think the biggest takeaway is the power of storytelling.
Okay.
It's not enough to just list your skills and experience. You need to bring them to life with compelling examples.
Yeah.
So think about those moments in your career where you faced a challenge, made a difference, or learned something really valuable.
So instead of just saying, I'm a team player,
Yeah.
you'd share a specific example
Exactly.
of a time you collaborated effectively
Yeah.
during a patient emergency, highlighting your role and the positive outcome.
Exactly. Paint a picture with your words.
Okay.
Let them see you in action.
Right.
It makes you memorable.
Yeah.
And it helps them connect with you on a human level.
Yeah, it's like the difference between reading a textbook and experiencing a story firsthand. The story always sticks with you.
Yeah, and remember, they're not just looking for someone who can do the job.
Right.
They're looking for someone who fits the culture, the team, the NHS values. So let your personality shine through.
Okay.
Be authentic.
Yeah.
Be enthusiastic.
I can feel that enthusiasm even through the video.
Oh, good.
It's like they're saying, this is why we love what we do.
Right.
And we want someone who shares that same passion.
Speaking of passion, another thing that struck me was their emphasis on self-reflection.
Oh, okay.
It's not just about prepping for specific questions.
Right.
It's about knowing your own values, your motivations, what truly drives you as a nurse.
So before you even step into that interview room, take some time to step into yourself.
Exactly. When you're grounded in your own values, you can approach those questions with confidence and authenticity.
Yeah.
You're not just trying to impress them.
Right.
You're sharing who you are and what you believe in.
It's like that saying, people don't remember what you said.
Right.
They remember how you made them feel.
Absolutely.
And if you walk into that interview feeling confident and grounded, That will leave a lasting impression.
Absolutely. This whole deep dive has really reinforced for me.
Yeah.
That interview prep is about so much more than just memorizing answers.
Yeah.
It's about connecting with your why, your passion, and letting that shine through.
It's about showcasing your skills.
Yes.
Your experience, and your dedication to the NHS.
Absolutely.
Okay, so we've covered a lot of ground.
We have.
But I'd love to go back to that breaking protocol question for a moment.
All right.
Can we unpack that a bit more?
Yeah, of course.
I'm still trying to wrap my head around how to approach it.
Remember, it's all about demonstrating your critical thinking skills and your commitment to ethical practice.
Right.
A strong answer might involve outlining the steps you'd take to assess the situation, weighing the potential risks and benefits of deviating from protocol, while emphasizing that patient safety would always be your top priority.
Could you give us a concrete example?
Sure.
Of how a nurse might face this kind of dilemma in a real ICU situation?
Certainly. Let's say you have a patient whose condition is deteriorating rapidly. And the standard treatment outlined in the protocol isn't having the desired effect. You've exhausted all other options and believe that a slight adjustment to the dosage or timing of a medication might be necessary to stabilize the patient.
That sounds like an incredibly stressful situation.
It absolutely can be.
Yeah.
But this is where your critical thinking and judgment come into play.
Right.
You'd need to clearly articulate your rationale for deviating from protocol. Document your actions meticulously and ensure you're acting within your scope of practice and the bounds of ethical care.
So it's not about being reckless or dismissing established procedures.
No.
It's about recognizing that sometimes in those rare and critical moments, you might need to make a judgment call. Based on your expertise and the specific needs of the patient in front of you.
Precisely. And it's crucial to convey that you understand the importance of clear communication and collaboration with the medical team in such situations. You wouldn't make such a decision in isolation, but rather in consultation with the attending physician and other relevant healthcare professionals.
That makes perfect sense.
Good.
It highlights the need for strong communication skills, teamwork, and the ability to advocate for your patients effectively.
Exactly. And the interviewer will be looking for evidence of those qualities in your response.
This is all such valuable information.
Oh, good.
I'm sure our listeners taking notes like crazy.
I hope so.
Before we wrap up, I want to touch on one last point that really resonated with me. The video talks about the interview being a two-way street.
That's a crucial point. You're not just there to impress them. You're also assessing whether this specific ICU and team are the right fit for you.
So don't be afraid to ask questions.
No.
This is your chance to learn more about the unit's culture, their approach to patient care, and the opportunities for professional development.
Absolutely. Come prepared with thoughtful questions.
That demonstrate your genuine interest and help you envision yourself as part of their team.
This has been such an insightful deep dive.
It has.
I think this has given our listener a real advantage going into that interview.
Fingers crossed.
It's not just about knowing the right answers.
No.
It's about understanding what's really being asked and using that opportunity to showcase your unique strengths and passion for critical care.
I completely agree. And don't forget, even if you don't get this specific job, the skills you've honed preparing for an ICU nurse interview are invaluable for any nursing role.
So true.
It's all about continuous learning and growth.
And speaking of valuable resources.
Oh, yeah.
We highly recommend checking out the full YouTube video from How to Become.
Yeah, they're great.
They've got even more tips and example answers to help you nail that interview.
And here's a final thought to leave you with. Remember that? Feeling confident and prepared comes not just from rehearsing answers, but from truly understanding your own values and motivations. What drives you as a nurse? What kind of impact do you want to make?
I love that.
Good.
It's like that inner compass will guide you. Even when you're faced with unexpected questions.
Exactly. So go in there prepared. Be yourself. Trust your gut. And let that passion shine through.
We're sending you all the good vibes.
Good luck.
For your interview. Go knock 'em dead.
Yes, absolutely. And, you know, even if you don't get this specific job, The skills you've honed preparing for an ICU nurse interview are invaluable for any nursing role.
Yeah.
It's all about continuous learning and growth.
So true. And speaking of valuable resources, we highly recommend checking out the full YouTube video from How to Become.
Yeah, it's a great channel.
They've got even more tips and example answers to help you nail that interview.
Yeah, they've got tons of stuff. Yep. Okay, well, this has been such an insightful deep dive.
It has.
I feel like this has given our listeners a real advantage going into that interview.
I hope so.
It's not just about knowing the right answers.
Right.
It's about understanding what's really being asked.
Yeah.
And using that opportunity to showcase your unique strengths and your passion for critical care.
I completely agree. And don't forget, even if you don't get this specific job, the skills you've honed preparing for an ICU nurse interview are invaluable for any nursing role.
So true.
It's all about continuous learning and growth.
And speaking of valuable resources, we highly recommend checking out that full YouTube video from How to Become.
About to Become, great channel.
They've got even more tips and example answers to help you nail that interview.
And here's a final thought to leave you with.
Okay.
Remember that feeling confident and prepared comes not just from rehearsing answers, but from truly understanding your own values and motivations. What drives you as a nurse?
Yeah, what kind of impact you want to make.
Exactly.
I love that.
Yeah.
It's like that inner compass will guide you.
Yeah.
Even when you're faced with unexpected questions.
Exactly. So go in there prepared.
Yeah.
Be yourself.
Be yourself.
Trust your gut and let that passion shine through.
We are sending you all the good vibes for your interview. Go knock 'em dead.
Good luck, guys.